Uh-oh. Why is it recording? Pause. Well, good afternoon, everyone. Thank you so much for being here. My name is Jenny Mon. I'm the Associate Director of Clinical Programs here at NCSD. Welcome to the first installment of our webinar series, Prepared to Support Women and Their Sexual Health. Today, we'll get an overview of the state of PrEP for women of color. And I'm happy to introduce our speaker for today, Mrs. Leisha McKinely-Beach. Leisha is founder and CEO of Cush Health Impact and Leisha.org. Mrs. McKinley-Beach also serves as a consultant who provides training and community engagement on HIV and other health issues that affect Black communities, specifically Black women. McKinley-Beach provides technical assistance on HIV program design and implementation for Black populations, capacity building assistance to health departments and community-based organizations, particularly on issues for women and communities of color, and mobilization for PrEP scale-up in Black communities. As HIV Prevention Program Manager at the Fulton County, Georgia Department of Health and Wellness in 2014 to 2016, she developed and launched a major testing initiative as well as community mobilization campaigns. Leisha also played an important role in catalyzing and supporting the launch of the South's first public sector PrEP clinic, specifically designed to spur PrEP access in Black communities. As the former Director of Technical Assistance and Stakeholder Engagement at the Black AIDS Institute, she helped develop the first ever national HIV survey of scientific and treatment literacy among the HIV workforce. Leisha also served in 2010 to 2011 as the HIV Prevention Director for the Georgia Department of Community Health, where she oversaw development of a comprehensive HIV prevention plan for Atlanta. We are so happy to have her here, Ms. Leisha McKinley-Beach. I'm going to go ahead and take myself off mute and hand it over to you. And I just want to add, if anyone has any questions throughout this presentation, please use the Q&A feature. So there's a Q&A feature. You can just type in your question. We will answer all questions. I do want to be very clear about that. We will answer all questions, but it helps us if we can organize them in the Q&A feature. But I do encourage you, to engage with each other in the chat box as well. Any feedback, but any questions for our speaker specifically, please place in the Q&A if you are able. Thank you so much. Leisha, take it away.
Thank you, Jennifer. And you guys don't know, behind the scenes, I was asking Jennifer not to read that whole bio, but she did anyway. So it is truly an honor. That's okay. Next time we can shorten. It is truly an honor to be here. Just a little fact, I have always wanted to do a presentation or workshop with the National Coalition of STD Directors. And so I'm getting to check something off of my professional bucket list today. And I'm so thankful that I get to do that with you as well. And so I see that there are people from all over the country. I got to give a shout out to Texas. That was the first one that I saw. From New York, Minneapolis, the big old state of Iowa, North Carolina, Miami, headed to my home state of Florida. And so so thank you so much for being a part of today. I know that some of us are zoomed out, and but you still are here, and so that really means a lot to me on today. And so we're going to be sharing a couple of slides looking at PrEP from our national landscape. What are we seeing across the country? And then kind of zoning in specifically on Black women. And as we go through the presentation on today, again, please feel free to add questions into the Q&A or comments into the chat feature. I'm going to do my best to make sure we incorporate all of those as a part of this presentation. Before we get started, I just want to share with you the image that you see on the screen, courtesy of the Black AIDS Institute, Black Women in PrEP. campaign that this image was one of my favorite. And because the image itself does not look like the person, when we think about women in PrEP, that's not who comes to mind. And so it is a constant reminder to make sure that we are not excluding individuals that could benefit from PrEP being a part of their prevention strategy. So shout out to the Black AIDS Institute for ensuring that women and all of our diversity are included. And speaking of women in our diversity, the presentation for today will center cisgendered women. Now, those of you who know me know I normally like to incorporate both cis and women of trans experience. But because we have 1 hour, I really wanted us to focus on some specific recommendations and things that we could implement for cisgendered women. So in this now 58 minutes, we're going to cover quite a few things. We're going to look at the environmental scan of PrEP and what our national landscape says about PrEP prescriptions, where we're seeing PrEP use the most across the country, and then talk about how that impacts women. We're going to look at some system changes. We always start with the end user, but not looking at how our systems might be barriers to the scale up or the uptick of PrEP among women. And then finally, I want to shout out some marketing campaigns that I have seen or been a part of, or you all have shared with me as it relates to Black women and PrEP. So stay on, hang in there with me. For some of you, I'm going to get to shout out your state. That's why I wanted to know that you were on with me. The landscape data should be no surprise to us. And these slides are infographics courtesy of AIDS View, part of Emory University's HIV system. And this particular infographic looks at PrEP use. This is 2018. It shows that states that adopted Medicaid expansion, or they had the PrEP drug assistance program, had higher uses of PrEP compared to states without Medicaid expansion. The states that you see with the yellow outline, those are the states that have expanded Medicaid. And the states that you see, I want to specifically go look at the southern region. You'll see that those are lighter shades of green, with the exception of Texas and the state of Florida. And I want to talk about Florida in just a second, but that's giving us a quick snapshot of where we're seeing PrEP use in the United States. This infographic looks specifically at the regions of the country, and it does a comparison with the southern region and the northeast region, that in the south, where we see the highest rate of new diagnoses, that there were only 3 PrEP users for every new HIV diagnosis, compared to 8.5 in the Northeast region. And so clearly that when we look at this particular infographic, it says where we're seeing the heaviest disease burden, we're not seeing the heaviest use of PrEP. And why is that? And what might be some strategies for us to start moving more closely in the right direction? We also know that 94% of the PrEP users for this particular period, 2018, were men, 6% were women. But let's also look at that there were 2 female PrEP users for every new HIV diagnosis. And so, we definitely see higher usage, whoops, I'm getting ahead of myself, among men than women. And I don't know how many people are familiar with the new AHEAD dashboard. AHEAD stands for America's HIV Epidemic Analysis Dashboard, and you can find that on the HIV.gov website. What I like about it is you have this opportunity to put in indicators that you want to view. And so this is one specifically for men. It looks at both the percentage of prescriptions written for males and the actual number prescribed PrEP. And so as you can see, 2017, almost 150,000 prescriptions. And then at the third quarter of 2020, and that appears to be the latest completed data, is the third quarter of last year, over 100,000 more prescriptions that were written for men. But when we look at female prescriptions, we'll see only about 11,000 in 2017, and then up to 20,000 the third quarter of 2020. So some huge disparities between men and women, cisgender women, as it relates to PrEP prescriptions. And when we think about these disparities, it gets us to really why we're here. So now we know it. For some of us, this isn't news. We've been seeing it. But what are we going to do about it? How are we going to address it? And when we start looking at a scale up model of PrEP, specifically for women, we have to look at some systems changes. And so even within the clinical guidelines, what are those recommendations for PrEP education and eligibility for women? If we are continuing to use terminology such as risk, are we excluding women who don't identify or perceive themselves to be at risk? Does the term risk add to some of the stigma that women are facing? And why aren't we speaking more about educating women about doing an assessment of their sexual health? Then that way we're not creating these systems that are saying, based on these few indicators, you are at risk of HIV, versus doing an assessment of your sexual health and then implementing these tools to help you to prevent HIV transmission. Eliminating a profile of high risk or at risk, and incorporating PrEP education and promotion for women who are sexually active across the board. I think that many times part of this battle that we are facing is we want to be able to say that based on these criteria, condomless sex, based on the increased number of sexual partners, then a woman is at risk. And if she doesn't fit into that criteria, then she's not at risk. But what that does is it gives women a false sense of security. Just want to share a really quick story about a provider that I had, who I had to ask for an HIV test as a part of my annual health exam. When that provider looked at my chart, he apologized for not offering me an HIV test. And he said, "I thought that you were married." So even in this healthcare setting, there's a profile that's created based on even whom the physician should offer an HIV test to. And based on my marital status, that exempted me from needing an HIV test. And so just looking at my own personal experience, it says that we run the risk of not providing the education for women who might indeed need HIV testing, regardless of their marital status. And so it's retraining our healthcare professionals to think about this in terms of an assessment. Because if we don't, not only are we not going to see the scale up of PrEP among women, there are going to be women who truly indeed need this as a prevention strategy. They are not knowledgeable that this is even an option for them, and the provider isn't informing them, and they can leave a session. And we've seen the data that has shown people who have seen their primary care providers had annual exams, and in 90 days they've seroconverted to HIV because that conversation did not happen. Now, PrEP should not be a standalone. It should be a component of overall sexual health. And so, as we begin to talk about the stakeholders who are a part of this process or need to be a part of this process, think about at least once a year, women of childbearing age, and also some of us who are beyond childbearing age, yes, have annual exams. And so having the gynecologist be a part as a key stakeholder, having conversations about overall sexual health, introducing PrEP to women who are having their gynecological exams. So I want to give a shout out to the home state of Florida. I was so honored to be a part of this process. Florida, under its former Surgeon General, had made PrEP use a priority for the great state. And the Department of Health set a goal for every county health department in Florida, so all 67 health departments, to offer PrEP in some capacity. There's some health departments in the state that provide PrEP services, other health departments that were providing PrEP referrals, but all health departments would be doing something in terms of PrEP. The San Francisco Department of Health worked with the Florida State Department to provide these trainings. And I believe maybe 64 out of the 67 health departments completed the training, a really, really high number of health departments. And I bring this up because the first thing that comes to mind when I think of this Florida model is the highest health position in the state, the Surgeon General became a champion. And so as we begin to look at what does a scale up of PrEP for women look like, it looks like having the buy-in from leadership to be able to implement jurisdictional wide or statewide strategies so that women in rural communities, as well as women in the urban areas, get access to the same resources. So some of the health departments were utilizing the 340B, and so they were able to use their own local pharmacies. A majority of the health departments were accessing the medication from the state central pharmacy, so medication wasn't a barrier. And then bringing in the technical assistance experts with the San Francisco Health Department, allowing those local county health departments, whether they were urban or whether they were rural, to come up with their strategy for PrEP implementation within their areas. Now, there were some health departments where the nurse, she served as the admin person, as the vaccine specialist, as the entire HIV program. And I know that those of you who are joining us from rural areas know exactly what I'm talking about. It would not be realistic to have that person complete the assessments and do the education and all of those things. And so those health departments were referring folks to either community-based organizations or neighboring health departments, which were much larger and had greater infrastructure. But the point is that every health department was doing something. And then the state health office provided each of these health departments with PrEP tools and a PrEP resource kit and guide so that they knew if there were questions that they couldn't respond to, who do they contact? If there were eligibility questions, who's the person to contact? If they needed additional information or educational tools or wanted to set up training sessions, that the state health office had provided this resource guide so that they would have the information at hand. And Florida recognized that this is not a one-shot deal. And so having this one training would not mean that now 67 health departments were experts in PrEP implementation. What it did mean was that this was an opportunity for ongoing PrEP training through the AIDS Education and Training Center. So just a great model of where I saw having a champion implementing a policy that required all of the health departments to be a part of a system and seeing its impact. And so although I don't have the data to know what Florida's PrEP prescription rates looked like prior to the training, when I saw on the infograph Florida being the only state that did not expand Medicaid in that southern region, but had more prescriptions than some of the others, it made me think about their program. So I'm gonna pause here for just a second because I started seeing the chat feature light up as I started talking about Florida, and I wanna see if I'm able to, okay, I can't see the chats, but okay. All right. So let me continue and let me get to your questions. All right. The other thing that Florida did that was so impressive to me, and those of you who are on from Florida, please make sure you tell your state health office, like, oh, Leisha was giving you guys all this praise. They might be surprised. I digress. But looking at the scenario that Florida created as a part of their training, really showed for me how you gain the buy-in from these county health departments to really demonstrate why implementing the PrEP as a prevention strategy is necessary. And so Florida looked at scenario one. If we don't do anything, this would be the projection for 2020 of 27,475 new diagnoses. But if we at least had a PrEP use increase among the high risk populations, again, a term we're gonna try to move away from, but if we at least add that, then we see the number of projected new diagnoses reduce. And if we are able to get 85% of the people linked to care, 60% achieve viral suppression plus PrEP use, then we're down to almost 15,000 cases. So a significant drop from scenario one if we don't do anything. And so, and then in the fourth scenario, that if 85% of the people diagnosed are linked to care, 80% achieve viral suppression, plus we have PrEP use, then they're down to about 8,000 cases. So almost 20,000 less new diagnoses than if we did nothing. And I think this is a model that all jurisdictions should do in terms of looking at what we can implement, how we share with our community partners as a part of our PrEP scale up, not just for same gender loving men, but also for women of trans experience and cisgendered women. Okay. I'm looking at my time and I think we're okay to go through this slide. When we look at the clinical eligibility, I would like to ask the group, if you can use the Q&A, I think I have access to that while I'm presenting. Are there other eligibility requirements that you'd like to see in an assessment tool? And so here we see a negative HIV test result, no symptoms of acute HIV diagnosis, normal renal function. Are there anything else though that we should be looking at in terms of clinic eligibility? Okay. So if you can use the Q&A and let me know what other clinical eligibility that you think should be included here. Okay. Okay, able to complete routine follow-up. Okay. All right. And this is just the cover of the PrEP plan of action toolkit that I had referenced earlier. So shout out to Florida for their work in scaling up their PrEP program. And I know only the dinosaurs like me remember clipboards. But for the dinosaurs that are still using clipboards, they even took their clipboards to use as a source of a resource for healthcare providers. So from their PrEP line, their PEP line, to even their perinatal line if they had questions or needed information. Okay. All right. So while we are here talking about women, again, when we think about the stakeholders in this process, I really want us to shift our thinking from putting all the onus and responsibility on women to know about PrEP, to know that it's for them, to do their own education, to learn how to do their assessments. All of that's going to be a part of it, but are the stakeholders that are necessary, in my opinion, to see the scale up of PrEP for women are the OBGYNs, a group of medical providers that have access to cisgender women daily. And so within our jurisdictions, what are we doing to raise awareness to this population of medical providers about PrEP? What are we doing to educate them about PrEP? And also the primary care providers. I gave this model from Florida for the health department infrastructure. But we already know that all of the women, cisgender women who can benefit from PrEP, they are not gracing the doors of our health departments. And so the health department is one component of this overall jurisdictional strategy. So what are we doing to educate primary care providers? What are we doing to include pharmacists as a part of this infrastructure? Because think about it, pharmacists are the last medical provider between a woman and that first pill. And so are our pharmacists also educating women about PrEP? National Medical Association. And I'm certain that there are other medical associations as well that need to be included so that even before doctors are practicing primary care, specialty care, they're being introduced to how they implement or integrate the PrEP conversation as a part of the overall sexual health conversation that should be happening for cisgendered women. Right? What other medical providers would you consider to be stakeholders? Okay. All right. I'm at a disadvantage, but I'll keep moving because I can't see the chat. It seems to be the chat is where people are implementing things. So self-perceived need and actual need for PrEP. As I have been hearing people's stories, as I have been interviewing women who have either made a decision to choose PrEP as a part of their prevention strategy, or they have made a decision that they won't include PrEP as a part of their prevention strategy. There've been some consistent themes, and I've shared some of them with you already. But this notion of high risk versus low risk behaviors really are separating and giving some women a false sense of security that I don't have to worry about PrEP or HIV or any of those things because I'm considered low risk. And so I challenge this body that as we walk away from this meeting today, look at how we can change the terminology that we are more inclusive instead of excluding women who could benefit from PrEP and overall sexual health information. I challenge us to do our own assessment and ask the question, are we contributing to the stigma associated with PrEP by using the terms high and low risk? What would it be like if we were able to implement as a part of an assessment what pleasure you want to focus on? What about just the assessment of your sexual health? These things that are important to you, thus the perceived need, in order to get those things, these are the tools that you would have to implement. It sounds like using different language can also help cisgendered women understand our need for some of these prevention tools and strategies. So that's my challenge as we leave here today, to let us take a step back and look at our contribution to the stigma and what are some tools that we can implement to reduce it. And finally, I want to just shout out a few marketing programs across the country that I've seen, that even though we do not have a large scale marketing campaign for PrEP for women, as other populations have been afforded, that when I turn on my television and I see commercials for PrEP, I have yet to see one that includes me or somebody who looks like me. And so when I'm doing these workshops or educational sessions for women, I kid you not, it has yet to happen to go through one and not have one person raise the question, hey, are you sure this is for women? Or I didn't know that PrEP was for women. Here we are coming up on the 10-year anniversary for the FDA's approval of a medication for pre-exposure prophylaxis. And we still have women who don't know that PrEP is for them. So I want to acknowledge the states and the cities that have made a decision. I am not going to wait for a national campaign that is addressing PrEP for women. I'm not going to wait to turn on my television and finally see that women are included as a part of the conversation, that we are going to do something within our jurisdiction now. We might not have the resources to pay for commercials, but we got enough resources that we can put some ads on buses, we can build out some brochures, we can add to social media. And so to those jurisdictions, I say thank you. Thank you for continuing to raise awareness. So I want to show a few of those, and then I want to end with a video clip of an interview that I did recently with a young lady who has just started PrEP, and her message about marketing for PrEP. Okay. I think most of you have probably seen the campaign from the Black AIDS Institute. I just want to share a little story behind this campaign. I was very fortunate to work with BAI on this particular campaign. And as we went across the country conducting focus groups, there were some themes that came out of those focus groups that influence the type of imagery that you see. Some of those themes were, we are so tired of seeing images of just young women as if sex stops at 50. And now that I am knocking on AARP's door, I'm so glad to know that that's not true. It don't stop at 50. But the women were saying, so where are those images of the sexy senior citizens? Those need to be included. Other women said, where are the images of women who are proud of their crown and they wear their hair natural? Where are those images? Where are the images of women who are disabled? As if they don't have intimacy, that they're not sexually involved. And so we need those images as well. And so this is just an example of 6 of my favorites, looking at PrEP for women in all of our diversity. And so I do believe that these are still available for co-branding if a jurisdiction is interested in that. And you can contact the Black AIDS Institute for that. Okay. So I saw Florida on the call, so on the webinar, so shout out to Florida. This one is specifically Broward County, Florida, Fort Lauderdale. They took those images and they co-branded them. And you'll see that they also have their website, getprepbroward.com, as well as a phone number, so that if individuals are interested in PrEP from their marketing campaigns, then they could take action immediately by calling or by visiting the website. Now, I have to tell you, I was actually on vacation in Fort Lauderdale when I saw this bus roll by. And I was so excited. I was like, oh my, it's one thing to work on these campaigns, but it's something else to actually see it in action. And it was just such a rewarding experience for me to see that bus roll by and that women were getting informed about PrEP throughout the city. Washington, DC, their Her Life, Her Powered PrEP campaign. I got a chance to hear them present last week about not just only the images and the marketing material. So shout out to DC. I also got a chance to hear them talk about their local engagement sessions with women and talking to women about PrEP. And what they were seeing in DC is no different from the stories that I have heard from Houston and Atlanta, when folks are saying women still don't know about PrEP. And that some who do know about PrEP, they don't know that it's for them. And so all of these campaigns are helping to address the awareness of PrEP. To my great friends in Louisiana, they too co-branded some of the materials. So shout out to the Louisiana folks that are on. If you're on, I know you know Jackie Bickham. Jackie, this has been one of her babies in making sure that the entire state has these materials, from buttons to t-shirts to even the brochures, and making sure that women, Black women, know about PrEP and that they see images of themselves to know that it's for them. And then finally, my my state. I'm a peach now by way of being an orange first, but I love being in Georgia, and to see the Georgia Department of Health utilizing the local celebrities. We're very fortunate that we have access to many reality shows, but also many of those actors and stars from those shows who do have a passion for health and for HIV, and will give of themselves to be a part of a campaign. And so the Georgia Department of Public Health launched a campaign called Ladies Who PrEP, and the Real Housewives of Atlanta have been a part of the campaign from its inception to now, touring in even places like Columbus, Georgia. Some of you have never heard of it. That's a good thing because they made their way even to rural communities. And so it really does speak to the innovation and the utilization of resources that each jurisdiction have. I'm also excited because our Grady healthcare system has carved out a specific portion of their PrEP campaign for women. And this is literally hot off the presses. This campaign, it might be 60 days old. I'm so excited about it. And it's the promotion for women who live in the state to be able to access PrEP. The beauty of their campaign is that the counties, Fulton and DeKalb County, which is two of Georgia's largest counties, that the women who are accessing PrEP from those two counties, they don't have to pay for any of the service. So it's not just the medications that they are getting for free, but also the labs and the co-pays that are being covered as well. And the STD, so I know many of you will appreciate this, the STD services are being covered in partnership with the Georgia Department of Public Health. So shout out again to our STD champion, Miss Michelle Allen. And then finally, the PrEP and GYN services. This was a fact sheet that was created for Women and Girls Day by the Atlanta Black Women Leaders on PrEP. And this was just a group of women who work in HIV, that we come together once a month and we talk about strategies and ways that we can help support PrEP initiatives throughout the city. And we put together this PrEP and GYN services fact sheet. We identified those clinics throughout the city that offer GYN services, but they also offer PrEP. And to see a place the size of Atlanta and only to have four, I think there's one more that got cut off at the bottom, five locations, says that there's still a lot of work that we have to do. But let's acknowledge that we have come a long way, because now we can share with women that as a part of that annual exam, that there are places that you can also access PrEP services. Okay, before we get to questions, I want to stop for a minute and I want to share this clip from an interview that I did with a young lady who is utilizing PrEP. And so I'm gonna need you to let me know if you can hear this.
And remember to protect yourself at the end of the day.
And Shay, I couldn't have said it better. That really is the best message that we can give to our sisters. It's about you. And you assessing your wellness to determine what's gonna work best for you. Any final thoughts that you would give to health departments, CDC, healthcare providers, HHS, all of the three-letter organizations on how they can improve PrEP for women. What message would you give to this healthcare industry?
I feel like they should advertise it more for like everybody. From what I've seen from, watching commercials for PrEP, it just felt like it was more geared towards gay men. Even though it's higher in the gay community, I felt like they just forgot about women. Like, women don't have like multiple partners and act like they don't get it. But I feel like they should be able to target it better for both men and women and transgender. Like, I feel like it should just be open to us, especially us. And that way women out there would know, like, hey, I've seen this commercial about PrEP and I'm interested in getting on it. But for me, I had to get on it because of, the situation that I put myself in with that guy. I mean, there's been plenty of times when I've been on situations that I was like, I didn't hear nothing about PrEP until, a teacher talked to me and I'm seeing this commercial. Like, I feel like they should better market towards women as well.
Okay, and I just wanted to share a little bit of that interview because this is an end user. This is a woman who made a decision that PrEP was a strategy that she needed, not because of seeing a commercial. She's a CNA student, a certified nursing assistant, so she was knowledgeable because of a teacher who ensured in Atlanta, who was adamant about including HIV and PrEP education as a part of her curriculum. So I want to end with that those of you who are from health departments or community organizations, even the National Coalition of STD directors, that the efforts around the media and marketing campaigns are so critical and they're so important. We may not be able to see images of women on commercials now, but women are taking notice of what you're doing in your local jurisdictions. And so thank you so much for that. So let me try to get to some of the questions. I'll start in the Q&A first, and then we'll move to the chat feature. There's a comment about also including pediatricians to reach adolescent women when we talk about stakeholders. Absolutely, I couldn't agree more. I am the mother of a 16-year-old who's going on 30, and she has her PrEP plan. If PrEP is something that she needs, she's made a decision. I can't be a part of that. She said, I'll be the public health professional and not the mom. So we've already talked with the adult that she would have this appointment with, to take her to the appointment. And so it is important that pediatricians are included as well. I see midwives and the Title X providers to be included as well. Then there's a question about how open or not open are the conversations with women and their partners as it relates to PrEP. I think that's a really great question. Sometimes women don't have the tools that they need to have those conversations. And let's face it, I know that many of us work in the field and we've done this for a long time. And so talking about sex may come easy for us. But talking about sex doesn't come easy for all women. And some women just don't have the tools. And how do I even bring this up? And are we having conversations with women not only about how, but when? Because we don't want to put a woman in a position that could become violent for her. And so, again, having from the providers to the community organizations, being able to help her assess her environment as well as her need about having conversations about PrEP. Another person has a statement. It says the current media misleads the public into thinking that it's only for gay men. And that's why it's so important that as those commercials have not included cisgender women, that we have to now work extra hard to make sure that within our jurisdictions that women are seeing something associated with PrEP and with them. So whether it is the bus ads, whether it is the little commercials at the gas pump, Broward County also has implemented that as well. They've got these commercials at the gas pump, so that while you are standing there pumping now $100 worth of gas for 3 gallons, you get this PrEP PSA for women. And so let's utilize everything that we have at our fingertips within the local jurisdiction until those that have the deeper pockets can truly see the need to include women in commercials for PrEP. Let's see. Jennifer, did I miss any of the other questions there?
I think there's just one about pricing. It's indicated that a month's supply is nearly $2,000 a month without insurance. Most private health insurance companies, Medicare and Medicaid, will cover the cost, but private insurers may charge a higher copayment. Do you think this may be discouragement for cisgender women?
Yeah, I think that's an excellent question, and thank you. I definitely didn't want to miss that. I think that for some women, they've heard that question, right? That, oh, this is so expensive. You won't be able to afford it. But there's so many different programs that are now available to not only assist with the payment for the medication, but also to assist with the co-pays from the visits to the lab fees. And so again, being educated and informed about what that cost might be for you. For in some instances, like we see for the women here in Fulton and DeKalb County going through the Grady program, there is no cost. And so it becomes a part of our responsibility to be knowledgeable about who's providing PrEP within the jurisdiction and what those fees are as well, so that we can share that information.
Thank you so much, Leisha. I think that's the last question.
Okay. So we got 2 minutes left. Any other questions or comments that you all have to add to the chat feature? I just want to say thank you so much for staying here for the entire hour. I may not always be the most exciting speaker, but I really am passionate about making sure that women get the same access that other populations have to this intervention. It's so necessary. And if we're going to end this epidemic, we need to be focused on ending it together.
Thank you so much. Thank you all for your participation. Thank you again to Mrs. Leisha McKinley-Beach, who is an incredible speaker, I will add. We are so excited to have you join us for the next session. So next week, and it's the same date, so it will be next Tuesday, and it'll be the same time, so 2 to 3 Eastern for the remaining 2 sessions. So we try to keep it simple for you. But next week, we'll be hearing from women who are on PrEP and hear about, what that was like for them, particularly women in the South, what that experience was like. And then the third and final installment of the webinar series, we'll be hearing from health departments. What does this look like practically speaking? How do you implement these programs that really are women-centric and focused on women? So thanks again for attending. I did put the link to the registration box there in the chat. And again, the recording will be sent out to all attendees and all registrants. So we thank you again. Take care, and we'll see you next week.